The following video demonstrates how to identify the tip of a catheter when placing an umbilical venous catheter using Pocus. These pictures demonstrate the 1 and 2 provider technique for Pocus utilization during umbilical line insertion. The picture on the left demonstrates the 1 provider technique. Here you can see the sterile field extending from the nipple line to the groin and only 1 provider. This provider uses one hand to adjust the central line while holding the transducer with the other hand to guide the line adjustment. The picture on the right demonstrates the 2 provider technique. Here, the letter A represents the primary provider in the sterile field inserting the line, and the letter B represents the second provider outside the sterile field holding the transducer and guiding provider A to adjust the line. First, start by selecting the linear probe on your ultrasound machine, as you see in the video. Then, adjust the depth by pressing the highlighted button. The depth will be based on the baby's weight. Now, place the probe over the lower 1/3 of the sternum with the notch at 12 o'clock. You should be able to visualize the vertebral column. The picture on the right is a midline sagittal CT scan of the abdomen and thorax. The letter H represents the heart, and the letter L represents the liver, and the vertical red dashed line is the diaphragm. Throughout the video, the red dashed line will represent the diaphragm. The white arrow at the bottom of the screen points to the descending aorta, and the vertebral column is at the bottom of this picture. The picture on the left is an ultrasound image of the same anatomical section. Next, you need to adjust the gain. Place the probe over the mid-sternum with the notch at 12 o'clock. Then press the highlighted button on the keypad to adjust the gain. These 3 pictures demonstrate the difference between too little and too much gain. The aim is to visualize the aortic leaflets, heart borders, and heart chambers as seen in the middle picture. Next, to locate the RA-IVC junction, place the probe over the xiphy-sternum with the notch at 1 o'clock, as demonstrated in the picture. The video on the left contains a diagram that shows the anatomical pathway of the catheter, where the heart, liver, and major vessels can be identified. The solid yellow line represents an umbilical vein catheter passing through the umbilical vein, portal sinus, ductus venosus, and to the RA-IVC junction. Throughout the video, the yellow will represent the umbilical catheter. On the right side is the ultrasound image, where the catheter is visible as a double parallel hyperechoic lines. The yellow arrow points to the catheter in the ductus venosus. The white arrow is the RA-IVC junction, and the red dashed line is the diaphragm. The diaphragm should be in the middle of the screen, dividing the picture into 2 halves. This next video demonstrates the catheter in the correct position. Again, the yellow arrow points to the tip of the catheter, and the red dashed line corresponds to the diaphragm. Here, the video on the left demonstrates a UVC adjustment utilizing Pocus in real time. The video on the right shows the catheter in optimal position after adjustment. The next few slides will go over troubleshooting in case visualization of the UVC catheter with the linear probe is not feasible. Switch to the sector probe. This may be needed with bigger babies. The gain and the depth will need to be readjusted as well. As the video demonstrates, to see the UVC with the sector probe, first, place the probe over the xiphy-sternum. Then, slide the probe a few millimeters towards the patient's right side until the RA-IVC junction is identified. Now, rotate the probe so the notch is at 1 o'clock and slowly slide the probe towards the patient's left shoulder. And finally, rock the probe towards the patient's head. This next video shows the views to identify the RA-IVC junction. When the probe is placed over the xiphy sternum, the vertebral column will be visualized. As the probe slides towards the patient's right side, you will see the IVC, the RA, and the RA-IVC junction as labeled. This video demonstrates the landmarks and the catheter as they are seen using the sector probe. Finally, in the event of uncertainty of the central line tip location, an injection of 1 to 2 milliliters of sterile saline may be used for confirmation. The injection will cause turbulence that is demonstrated by an opacification as seen on this ultrasound.